The Senate Health, Education, Labor, and Pensions Committee will please come to order. Today we are having a hearing on reproductive care in America following the Supreme Court's devastating decision in Dobbs to overturn Roe v. Wade. I will have an opening statement followed by Senator Marshall. We will then introduce our witnesses, and after the witnesses give their testimony, senators will each have 5 minutes for a round of questions. And while we are unable to have the hearing fully open to the public or media for in-person attendance, live video is available on our committee website at help.senate.gov, and the live stream will include closed captioning. If you are in need of other accommodations, please reach out to the committee or to the Office of Congressional Accessibility Services. 3 weeks ago, the Supreme Court and the Republicans who dedicated years to swinging the court aggressively to the right dragged our country back 50 years. They overturned Roe v. Wade, ended the right to abortion, and upended the lives of millions of people. And the consequences have been harsh and swift. Women sobbed in clinics as they had their abortions canceled, their personal health care decisions overruled, their futures thrown in jeopardy, and their control over their own bodies taken away. It was heartbreaking, terrifying, enraging, and barbaric. And that was just day one. Since then, the devastating repercussions of Republicans' cruelty continue to crash around us. Women unable to get abortions for any reason. Healthcare providers unable to do their jobs without risking prison. Patients with lupus, cancer, arthritis, and more denied the medications that they need. Complete uncertainty for people planning their futures as access to Plan B and IVF have been thrown into jeopardy. And Republicans' response to this devastation is to discuss how they can push even further, be even harsher, take even more power away from patients, and scare even more doctors out of their jobs. Some Republicans are talking about a federal ban on abortion, overruling laws in states like my home state of Washington and ripping away rights from my constituents. Republicans are talking about criminal penalties for women and healthcare providers and about making traveling to get an abortion illegal. They are talking about everything except the actual harm they're causing. This is a healthcare crisis that was entirely avoidable and is entirely their own creation. I have been warning for years about Republicans' attacks on reproductive rights putting lives at risk, and I'm far from the only one. Women, providers, and patients across the country have all been shouting from the rooftops that overturning Roe would be devastating. But Republicans refuse to listen to me or to the majority of people across the country who wanted Roe to stand, who wanted to keep their rights and preserve women's ability to control their own bodies. And Republicans are still continuing to spread disinformation about the reality that we're now facing and about the consequences of this backwards agenda. When the leaked decision came out, Republicans tried to say they weren't going to put women and doctors in jail, even as state legislatures across the country were already moving to do just that. And they are still trying to say it won't be that bad, even when it is clearly devastating for women across the country who they are ignoring and oppressing. Well, today we are going to hear exactly what this cruelty means for women seeking abortions, women Republicans will force to stay pregnant when they do not want to be, women whose bodies Republicans are taking control of without their consent and against their wishes. And this isn't just about whether people want to be parents. Though let me be perfectly clear, we must do way more than Republicans have ever dreamed of doing to actually support parents. Childcare, paid leave, you name it. Republicans have blocked Democrats' nonstop efforts to deliver for working families. But anyone who has given birth also knows this isn't just about whether you are ready to raise a child. Pregnancy is a life-changing medical procedure. It takes a physical toll. It takes a mental toll. And for too many women in our country, it takes their life. No one should be forced to go through this against their will. But Republicans are going to force women to stay pregnant, not only when they don't want to be, but even when it could kill them. Just ask Elizabeth, who I spoke with last week in Spokane. She has been pregnant 4 times, all planned, all wanted. But twice she learned her pregnancy would be fatal if it was not ended. In the first instance, she got the heartbreaking news that one of the twins that she was carrying had died. The other could not possibly survive outside the womb, and that her life was now in grave danger. In the second instance, she was told that without immediate action, she would lose too much blood to survive the night. And as she told me, and I quote, "Had I lived in a state without access to safe and legal abortion, I would have died, bleeding out on the side of the road, trying to make it to a state that would help me." Those are the stakes, and not just for Elizabeth, but for many patients. About 1 in 50 pregnancies in our country are ectopic. That means they're not viable, and without medical action, they are deadly. But in Republicans' post-Roe world, healthcare providers aren't sure when or even if they will be able to treat ectopic patients without being sent to prison. Some have already been instructed to observe patients until they have unstable vital signs before acting. Basically, sit on your hands until women are at dire risk before you can do what is medically necessary. That is absolutely barbaric, and it's a policy choice that Republicans have made. Now, some may try to suggest that patients go to another state, but if you're in the middle of a medical emergency that's dangerous or impossible, not to mention that some Republicans are already talking about banning interstate travel. And we cannot lose sight of the fact that the same patients and providers that are hurt by these restrictions are on the front lines of our nation's maternal mortality crisis. We have the worst maternal death rate in the developed world. And in the very states where it is the most dangerous to give birth, Republican legislators are now forcing people to give birth against their will. It doesn't take an expert to understand this is only going to get worse because of the dangerous abortion bans. Women will be denied the care they need, the care their doctors know could save their lives. States will lose maternal health care providers who understandably don't want to live where they could be jailed for doing their job. This will be especially hard on people in rural areas, on women of color, and on women with disabilities who already have a particularly difficult time finding a provider who takes their concerns seriously and understands their health care needs. And it can be even harder still for transgender patients seeking reproductive care while facing stigma, discrimination, and bigotry. And make no mistake, this isn't just going to devastate patients in states with abortion bans. First off, I want to be very clear. Republicans have been explicit. They want to go further. They want to pass legislation to go after people who help patients travel for an abortion, and a national abortion ban that would trample the rights of patients in Washington state. And secondly, even now, health clinics are being overwhelmed. I was in Spokane last week, only miles from the Idaho border, and providers there are already seeing an uptick of patients and preparing for a huge surge of patients seeking care when Idaho's extreme ban goes into effect next door. We are talking as many as 5 times more people seeking abortions at our clinics. They are on the front lines of a full-blown healthcare crisis. And let's not forget there are so many women who cannot travel to get an abortion, who don't have the time or the resources, who face barriers to accessible travel, or are too young to drive themselves. There's also the very real risk that people with no other options will turn to dangerous, even deadly, misinformation that is spreading on social media. Because, as I have warned before so many times, banning abortion doesn't stop abortions. It just stops people from getting safe abortions. And it is not only women seeking abortions who are having their lives totally upended by Republicans. It's women seeking birth control. Some Republicans have discussed going after contraception next, and Justice Thomas said the Supreme Court should overturn the right to birth control. People hoping to start a family using IVF could also be under threat. IVF providers have serious concerns about whether parents and providers could be punished if an embryo doesn't survive being thawed for implementation or for disposing unused embryos. That isn't idle worrying, because Republicans in several states have already proposed extreme bills that ban abortions starting at conception and could impact IVF and some methods of birth control. And already, pharmacies have told patients with lupus, arthritis, and other conditions they can't fill their prescriptions due to concerns the drugs would be used for an abortion. And let's be clear, those drugs the FDA approved as safe and effective for their condition years ago. There are also cancer patients who may be unable to start chemotherapy until they can get an abortion. And then there are people who have a miscarriage. Abortion bans could jeopardize their health and stop them from getting the care they need to end their miscarriage. And afterwards, they could still face another nightmare, being reported by someone who thinks they got an abortion. Imagine going through the heartbreak of losing your pregnancy and then being put in prison for it. And this doesn't have to be an exercise in imagination. From 2006 to 2020, over 1,000 women in this country were investigated, detained, or arrested because of their pregnancy outcomes. That is horrific. If it's a problem we should be trying to solve, and instead, thanks to Republicans, it's about to get dramatically worse. That's why people across the country are so scared and so heartbroken and so angry, and I am too, because the stakes could not possibly be higher. That's why I led Senate Democrats in pushing President Biden and his administration to do everything they can to protect access to abortion and reproductive health care. And President Biden's executive order on abortion last week was a good, important step, but this fight is far from over. As we continue living through a post-Roe healthcare crisis, I am still urging the President to continue to fight back. But with limited executive authority, ultimately, we need more pro-choice senators in the Senate willing to waive the filibuster so we can protect women. If we can get that, we can codify Roe as well as put in law key protections for women. It is as simple as that. We also need to hold Republicans accountable for the harsh reality they have now created. And that is why I'm holding this hearing today. It's why later this week we will call for unanimous consent to pass a bill to protect women who travel to another state for abortion care, to show the stark contrast between Republicans' cruel agenda and Democrats' steadfast commitment to making sure women can get the reproductive health care they need. And it's why I'm going to continue standing with women and lifting up patients' voices. Anyone who thinks I'm going to stop, any Republican who thinks people will forget about this in a few months, you still don't get it. How do you forget being denied your prescription because of this, or being denied your birth control? How do you forget having to drive across states to end a pregnancy so you can fight for your life against cancer? How do you forget being forced to choose between saving your patient or going to jail? How do you forget your dream of starting a family through IVF becoming a legal nightmare? How do you ever in your life forget being investigated for your miscarriage or driving your 10-year-old daughter across state lines after she was raped and could not get an abortion otherwise? And how little do you have to care about women to think anyone will forget the people who are killed by this? Women who can't get an abortion but need one, who turn to unsafe information because they were denied access to safe medical care. People who couldn't get a prescription filled, couldn't start chemo, or died in a maternal health care desert since doctors don't want to be treated like criminals for doing their job. People will not forget those losses. They will sit across from that empty chair every day, and they will sleep next to that empty space every night. Mark my words, they will not forget. And Democrats are not going to let Republicans ignore them either. We will not let them whistle past the graveyard they have been spent so long digging. And we will absolutely not stop fighting with everything we've got to end this chaos, save lives, and codify the right to abortion into law. We will never stop fighting for women's rights to control their own bodies. Never. Senator Marshall.
Thank you, Chair Murray. Overturning Roe versus Wade was a historic occasion that signals a new beginning for millions of unborn American babies. Now the future of saving lives rests with the American people and their elected officials in the states. But this work is not finished. Family planning opportunities need to be expanded, and mothers need greater access to services that will support them and their baby throughout and after the pregnancy. I'm looking forward to informing the American public why the Supreme Court's decision is a positive development for our country and setting the medical rectors straight in the face of non-fact-based, pro-abortion fear-mongering. I appreciate Ranking Member Burr for yielding me the opportunity to lead this hearing, to use my knowledge and background as an OBGYN who delivered a baby nearly every day for 25 years, as well as held the hands of hundreds of women suffering miscarriages, ectopic pregnancies, infertility, and life-threatening obstetrical complications. Having delivered more than 5,000 babies and started and supervised multiple family planning clinics, I'd like to dispel several myths that are being heaved at the public. Myth number one, overturning Roe is a federal ban on abortion. No, that's not true. Overturning Roe actually sends the issue to elected state officials, allowing the citizens of each state to address a highly emotional issue via their elected officials. Nevertheless, we will hear this false battle cry multiple times this morning. Myth two, women will not have access to abortion. That's not true. Even the New York Times reported after overturning Roe, abortions will decrease by only 14%. It's also worth noting that after Texas passed its heartbeat law, 2 studies showed that abortions fell around 10%. After Roe, 27 states and Washington, D.C. continue to be largely unaffected, while 19 states will have protected limits. The other states will most likely fall somewhere there in between. Myth 3. Overturning Roe means healthcare professionals and hospitals cannot treat women with miscarriages, ectopic pregnancies, or when the mom's life is endangered. These are all scare tactics, preying on the emotions of people. Listen, every state abortion law triggered by overturning Roe includes an exception to save the life of the mother. Treating miscarriages and ectopic pregnancies are not the same as performing abortions. In fact, no abortion law in any state in America prevents treatment for women with ectopic pregnancies and/or other life-threatening conditions. I remember my first year in residency when we were learning about ectopic pregnancy, and our motto was to never let the sun set on an ectopic pregnancy. That motto will be continued throughout America. Every pro-life physician I know of, every physician that I know of, including myself, has always and will always care for these clinical conditions, and there are no laws that prevent such. This is a total fabricated myth. Myth 4. I quote members across the aisle on this myth. Overturning Roe is devastating to women's health. Members will imply today carrying a baby to term is more dangerous than an abortion. So using their logic, should we abort every baby? Should we stop all childbearing? Presenting abortion as the life-saving solution for women facing challenging pregnancies is a warped view of health care. It denies the modern medical science that can bring both mother and baby safely through even a high-risk pregnancy. Myth 5, Americans don't support limits on abortion. A recent poll from the AP and NORC Center for Public Affairs Research finds while 61% of Americans say abortion should be legal in most or all circumstances in the first trimester of a pregnancy, 65% said abortion should usually be illegal in the second trimester, and 80% said that about the third trimester. And from a June Monmouth poll, only 36% of Americans support abortions as always legal, while only 30% believe it should be legal with limitations. Myth 6. Many claim that the United States fell behind our international peers on abortion access. Look, only 7 nations allow abortions beyond 20 weeks, including China and North Korea. The final myth I'll talk about this morning. Here's the myth. Republicans want to end contraception and family planning. Nothing could be further from the truth. In my first year in residency, after I delivered several babies that were 13, their moms were 13 years of age, I made a commitment to make sure that there was early access to prenatal care for everybody and access to contraception as well, regardless of a woman's ability to pay in any community I practice. And that's why I set up and volunteered at prenatal and family planning clinics in residency, and that's why I oversaw 3 community health centers in rural Kansas and accepted all comers to our prenatal clinic. And this is why every year we fight for robust funding for community health centers and health departments. So what does obstetrical care look like after Roe? We've dispelled many of the myths. Women with miscarriages and ectopic pregnancies will be treated in every state without exception. Life of the mom will continue to be honored, and Plan B remains over the counter. Republicans and Democrats must work together and continue to fight for more and earlier access to prenatal care and proper nutrition, especially in rural and urban settings, as well as child care, and attending to all the social challenges that I've seen so many times that a young single or married mom faces. This is why I co-led the Preventing Maternal Deaths Acts of 2018, and more recently worked with everyone here on this committee to pass legislation, the Maternal Health Quality Improvement Act, which was also recently signed into law. And this is why I lead annual appropriation letters supporting vital maternal health programs at HHS and the WIC program. While such centers as the Stanton Center, which you'll soon learn about, already outnumber abortion clinics 4-to-1 in this country, we can and will do more to help such clinics. I look forward to bipartisan cooperation to being part of the solution to maternity issues, which have all precipitated prior to this Supreme Court decision. Finally, we recognize family planning and access to contraception will be as important as ever. As I have in the past, I will continue to support robust funding for community health centers and county health departments like the ones I once volunteered and oversaw. Thank you, Madam Chair, and I yield back.
Thank you. We will now introduce today's witnesses. Our first witness is Dr. Kristen Brandy. Dr. Brandy is an obstetrician gynecologist who provides abortion care in New Jersey. She also serves as board chair for Physicians for Reproductive Health and is an assistant professor at Rutgers, New Jersey Medical School. In her work as a physician and researcher, Dr. Brandy has focused on reproductive decision-making and racism in reproductive health care. Thank you for joining us today to share your important perspective as an abortion provider and talk about how Dobbs' decision will undermine your care for your patients. Look forward to your testimony. Our next witness today is Dr. Jamila Taylor. Dr. Taylor is the Director of Healthcare Reform and Senior Fellow at the Century Foundation and an expert in reproductive rights and maternal health. For over 2 decades, Dr. Taylor has worked to champion the health and rights of women of color and other marginalized communities and ensure access to reproductive and maternal health care, including building support for insurance coverage of abortion. She also serves on the board of directors for the National Quality Forum and March for Moms, on the Reproductive Freedom Leadership Council Advocates Advisory Board of State Innovation Exchange, and as chairwoman of the board of Mama Toto Village, an organization focused on promoting Black maternal health. So glad you could join us today, Dr. Taylor. Look forward to hearing from you. Our next witness is Sami Detzer. She is an abortion advocate. She has been an outspoken abortion advocate for years, sharing both the story of her own experience getting an abortion when she lived in Washington State and her mother's story seeking an abortion back in the days before Roe v. Wade. She knows personally how much is at stake at this moment for many people across the country. Thank you for your courage in sharing your story today, Ms. Detzer, and speaking up on behalf of many women who are outraged to have their rights taken away. Look forward to your testimony. Senator Marshall, if you want to introduce our final witness.
Thank you, Chair Murray, for the opportunity to introduce Ms. Brandi Swindell from Meridian, Idaho. Ms. Swindell is the founder and CEO of Stanton Healthcare and Stanton Public Policy Center. Stanton Healthcare provides medical care, women's wellness care, tangible support, and hope to pregnant women, mothers, and their families. Stanton Public Policy Center is a women's advocacy and educational group that works on issues of human rights and justice with the goal of empowering and inspiring women. Ms. Swindell is a nationally known speaker and advocate for human rights and has been a passionate voice for women and the unborn. Ms. Swindell, thank you for all that you do and for being with us here today. Chair Murray.
Thank you. And now we will begin with our witness testimony. Again, thank you to all of us for joining us today. Dr. Brandy, you may begin with your opening statement.
Thank you. Good morning, Chairwoman Murray, Ranking Member Marshall, and the members of this committee. My name is Dr. Kristen Brandy. I use she, her, aya pronouns. I am a board-certified OBGYN, a complex family planning specialist, and I'm here on behalf of Physicians for Reproductive Health as the board chair. I've been providing comprehensive reproductive health care for over a decade, including abortion care, prenatal care, gynecologic procedures, and outpatient care. I am a proud abortion provider from the state of New Jersey. I became an abortion provider for the same reasons that I became an OBGYN, to help historically oppressed folks access the care they need and deserve. Obstetrics care has always been stigmatized and marginalized. It's no surprise to me that the same places that have banned abortion also have the highest rates of maternal mortality, and there are many systemic and social factors that play a role in this. I remember taking care of a patient with a desired pregnancy at 17 weeks whose fetus had not developed a brain. She decided she would end her suffering and that of her potential child by having an abortion. And her decision had become so stigmatized that I remember staff not even wanting to enter her room. I knew then that my career would be dedicated to ensuring that no patient is shamed for making the best medical decision for them and their families. By being a full-spectrum OBGYN, I could provide the best care for my patients. I'm here today to make clear that abortion is essential health care. Abortion can be necessary to save someone's life, and it is a critical part of being an OBGYN. National medical organizations have expressed outrage at the Dobbs v. Jackson Women's Health decision. And National Academies of Science, Engineering, and Medicine put out a comprehensive report looking at abortion outcomes and found that abortion care has one of the highest safety records in medicine. We know that in the United States, you are 14 times more likely to die in childbirth than you are to die of an abortion. And we know from the Turnaway study that people denied access to abortion have a higher chance of facing poverty and having worse health outcomes compared to patients that were able to access an abortion. I am a pro-abortion doctor, and I say pro-abortion not to be antagonistic, but to point out all the good that abortion can provide for people. Without autonomy, without decision-making ability, without access to abortion care, many people have challenging situations that can become even more painful or life-threatening. And for those that do not want to be pregnant for any reason, the ability to have an abortion gives them the freedom to decide if and when to become pregnant. For some, abortion is liberation. There's a lot of good that comes from people's ability to access abortion, and I want to celebrate that. I firmly believe in the tenets of reproductive justice, that all patients have the human right to be able to decide if and when to become pregnant and to parent those children in safe and sustainable communities. I cannot separate my ability to provide care as a physician from my lived experiences. I'm a cisgendered woman who could be harmed by restrictive abortion bans. I'm also a Latina, a daughter of Puerto Rican and Panamanian parents. I'm also a bisexual woman and deeply identify with the LGBTQ community, a community also in deep need of timely, compassionate reproductive health care. People of low income, BIPOC folk, queer folk, people with disabilities, young people, people facing incarceration or detention, and immigrants who have faced many barriers to accessing care even before Roe was overturned, now face bigger hurdles. So I understand deeply how restrictions on abortion and outright bans impact marginalized communities because they are my community. I am greatly concerned that abortion bans will tie health professionals' hands when it comes to providing evidence-based care for patients. It is heartbreaking to consider that the skills that I have, the medicines that have been proven time and again to be incredibly safe, will be barred from patients. I took an oath to care for my patients. We are supposed to bring evidence-based care to our communities. It is unconscionable to enact laws that prevent healthcare providers from offering the standard of care. There are many urgent healthcare conditions that can arise from or be exacerbated by pregnancy for which abortion is indicated. There are already reports of having to wait for a patient to become sicker and sicker before intervening. Future healthcare providers may not have access to training to even learn how to provide an abortion and will be ill-equipped to act in complex situations. This is not how healthcare should work. People are being harmed without abortion access. In conclusion, this moment is truly horrifying. I am frightened for my patients that may be criminalized for making decisions, and for health professionals that are providing high-quality, evidence-based care. But I won't give up. I'll provide care like I provided last week, again and again. It's important because I know my patients need it. Please remember that there are countless people in each of your states that have needed and benefited from abortion. You all love someone that's had an abortion. They deserve your consideration and protection. Thank you.
Thank you. Dr. Taylor? If you want to turn on your mic.
On now?
Yes.
Good morning, Chairwoman Murray, Ranking Member Burr, and members of the committee. Thank you for the opportunity to testify today on reproductive care in a post-Roe America. I'm Dr. Jamila Taylor, and I serve as the Director of Healthcare Reform and Senior Fellow at the Century Foundation, a 100-year-old progressive think tank that conducts research, develops solutions, and drives policy change to make people's lives better. I sit here before you today, deeply dismayed by the U.S. Supreme Court's decision to overturn Roe v. Wade. Not only am I disturbed by the impact this landmark decision will have on the health and well-being of millions of women and people who want and need abortion care, I'm also frightened by the impact this decision will surely have on this country's ongoing maternal health crisis. U.S. maternal health outcomes are worsening at an alarming rate, with Black women and birthing people bearing the brunt of this crisis. According to the most recent estimates released by the CDC, Black women are dying of pregnancy-related causes at 3 times the rate of their white counterparts. We are also most likely to experience severe maternal morbidity. For Black women, pregnancy and childbirth, no matter how planned out or desired, puts our lives at risk. It is always unconscionable to force the continuation of an unwanted pregnancy, but for Black women and other populations who have been historically marginalized, it is particularly immoral and dangerous. Abortion care is overwhelmingly safe. When abortion is difficult or impossible to access, complicated health conditions can worsen and even result in death. For example, one study conducted by researchers at the University of California, San Francisco, found that women who were denied abortion care are more likely to experience high blood pressure and other serious medical conditions during the pregnancy, more likely to remain in relationships where interpersonal violence is present, more likely to experience anxiety and stress shortly after being denied care, and more likely to experience poverty. Research also shows that states with the most restrictions on abortion are precisely those with the worst maternal health outcomes. This is no coincidence. These states also have fewer supportive policies in place for parents and their families. Supportive policies like universal child care, paid leave, affordable health care, equal access to nutritious foods, and adequate funding for the wraparound services low-income families and families of color desperately need. If we want to actually support women and families, then equitable access to compassionate abortion care must be paired with policies that make it possible to raise a family in the first place. In the face of the Supreme Court's decision to overturn Roe and the impact it will have on the maternal health crisis in this country, there are many policy solutions that can help address these challenges. Congress must pass the Women's Health Protection Act, critical legislation to restore the federal right to abortion, and it must be combined with the Equal Access to Abortion Coverage and Health Insurance Act, also known as EACH, so that abortion care is affordable and accessible to all, regardless of income or source of insurance. Last but certainly not least, Congress must pass the Black Maternal Health Omnibus Act, a comprehensive legislative package aimed at addressing various dimensions of the U.S. maternal health crisis among Black women and ensure that postpartum Medicaid coverage extends to a full year for every birthing person in every state. The twin emergencies of the maternal health crisis and lack of federal protections for abortion will in fact harm Black women the most. Both crises stem from historical and ongoing racism tied to the legacy of reproductive control and coercion. Make no mistake, these disparities are rooted in racism, not race. This racism can be seen today in the persistence of discrimination, unequal distribution of resources, and inequitable access to care. With our bodies and healthcare decisions under unprecedented attack, it is critical that we finally address the maternal health crisis while also increasing access to abortion so that every Black woman and every birthing person in this country can control their reproductive lives. Thank you again for the opportunity to testify, and I look forward to your questions.
Thank you. Ms. Detzer.
Chair Murray, members of the committee, thank you for inviting me to speak with you today. My name is Sami Detzer, and I have two stories to share. The first is fairly simple. On May 20th, 2015, in Seattle, I had an abortion. I was 25 years old, I was pregnant, and I did not want to be. It took me 5 minutes to schedule my abortion, which was covered by Washington State's Apple Health program. I received compassionate, expert care from the providers at Planned Parenthood in my own city and in my own state. My abortion was not painful, and it was certainly not traumatic. I was not lonely or depressed or ashamed. I can remember more about the relief than the tears, more about the feeling of freedom than of pain. I have not considered what my life would be like now if I had a child, and I have never once agonized over my decision. That story is mine alone. No one interfered to stop me from making the best decision for myself. No one tried to take control of what was mine, my body, my freedom, or my choice. And the second story is my mother's. She was 19 and living in San Francisco with my father when she got pregnant. They were simply not ready to be the exceptional parents that they would later become. It was 1968 before the Supreme Court's decision in Roe v. Wade guaranteed the constitutional right to abortion. And her doctor informed her that the only way to receive a legal abortion in the United States was to have a team of psychotherapists deem her mentally unfit for parenthood. She agreed to this process, was 3 times called officially crazy, her words, and was granted the right to have a legal abortion. And this process took just shy of 20 weeks. She received her legal abortion finally at 5 months pregnant. Unlike my experience, my mother's procedure was needlessly painful and was physically and emotionally traumatic for her. My mother was open with her 3 children about her experience, but I don't know everything about it. I don't know how, in the world, living across the country from her family and hiding her pregnancy from them, she was able to scrape together the money for 3 therapists and the abortion itself. I don't know what it was like for her to carry a pregnancy she did not want and to endure comments from strangers as she began to show. I don't know the extent of the judgment and shame my mother was subjected to. And unfortunately, I can't ask her because she passed away 4 years ago. I miss my mother every day, but I am glad that she is not here to see this terrible moment in our country's history. I do wish that she had the chance to meet her granddaughter, my 2-year-old niece, Sadie, who will devastatingly grow up with fewer rights than I had. I wish that I didn't need to share the personal details of my life, of my mother's life, with a room full of strangers. I wish that I could feel confident that my niece would grow up with the right to make choices about her own body. And yet here I am. I'm telling these 2 stories because of the dual responsibility that I feel to honor both my mother and my little niece. The responsibility that I have to honor the past and fight for a better future. The members of this committee, the members of this Senate have a choice. The choice lawmakers have is how difficult you will make it for us to exercise our freedom, how much pain and trauma you will cause, how many bank accounts will be drained, and how many miles will be traveled, and how many tears will be shed. Lawmakers can decide if people in this country will be able to get the health care they deserve. They can decide if states will be allowed to create insurmountable barriers to abortion or ban it completely. Lawmakers can decide whether our country will look like my mother's story or mine. What they cannot do is take away our freedom to our own bodies. No judge or justice can take away my right to decide what is best for me, my body, or my future. That freedom is ours, and we will not surrender it. I hope, for the sake of my mother's memory and for my niece's future, you will make the right choice, senators. People who want or have had abortions need to know that they're not alone. We need to know that you will continue to fight for us. I hope that you will choose to be brave alongside those of us who are telling our stories, and that you will use every tool you have to protect our right to abortion care and reproductive freedom. Thank you.
Thank you very much. Ms. Swindell.
Chair Murray, ranking members Burr and Marshall, and members of this committee, thank you for giving me the opportunity to share today. My name is Brandi Swindell, and I'm a fourth-generation Idahoan human rights activist and the CEO and founder of Stanton Healthcare and Stanton Public Policy Center. Stanton Healthcare is a women's healthcare provider which specializes in serving women with unexpected pregnancies by providing professional medical care, practical and emotional support, women's wellness care, and an outreach to refugee and marginalized communities. We are based in Idaho with affiliates in the U.S. and internationally. Stanton is a part of a women's movement which has over 3,000 pregnancy resource centers and life-affirming medical clinics across the nation that outnumber abortion clinics 4 to 1. Women who walk through our doors are treated with dignity and equality, regardless of their race, political views, religion, or economic situation. After the Supreme Court overturned Roe v. Wade on June 24th, so many have asked the pro-life community, are you ready to support women in a post-Roe America? And I can say with certainty, thousands of pregnancy centers and life-affirming women's medical clinics have been waiting and preparing for this moment for decades. We are ready to meet the challenge, and we are going to make sure that every woman facing an unexpected pregnancy in a post-Roe America will have access to life-affirming quality care, compassionate resources, and tangible support. Yesterday, in my home state of Idaho, Stanton Healthcare organized and led a symposium called Supporting Women in an Abortion-Free Idaho. Political, faith, and community leaders, educators, and organizations all came together in a nonpartisan way to find creative and life-affirming solutions as we unite to support women with unexpected pregnancies. We are excited that other states are following Idaho's lead. In a post-Roe America, shouldn't our nation's goal and the goal of this committee be to put aside divisions, anger, and partisanship and commit ourselves to serving and helping women? As political leaders and members of this committee, you can support women with unexpected pregnancies by passing legislation that would provide better prenatal and medical care for the marginalized and women from communities of color. Paid maternity leave and childcare are steps in the right direction. Since May 2nd, there have been over 60 attacks on centers like Stanton Healthcare. These attacks are unconscionable and ultimately threaten the women who attempt to walk through our doors seeking access to our services. Because of this, Stanton has had to hire a private security firm, which has cost our organization thousands of dollars. For those who disagree with the Supreme Court's decision on Roe, directing revenge and retaliation on centers like Stanton Healthcare is misguided, it's hateful, anti-women, and must be condemned and stopped immediately. Today, I am calling on all members of this committee to personally and publicly condemn the firebombing, violent attacks, and threats against life-affirming charitable women's clinics. Congress and the Biden administration should be a part of the solution and not cast blame on centers like ours. It is also deeply troubling members of the press, politicians, and media outlets refer to centers like Stanton as fake clinics. First, we are attacked with physical violence. Next, we are attacked with the violence of lies, disinformation, slander, and falsehoods. To diminish Stanton Healthcare in this way insults our medical directors, who are highly regarded MDs, our physician assistants, nurses, sonographers, and others on our medical team who have worked so hard to achieve, and maintain their medical credentials. But most of all, it insults the thousands of women and their children who have been helped by our clinics. They did not receive fake medical care or fake baby formula during a nationwide shortage, or fake baby supplies, fake financial support, or fake counseling, and so much more when they walked through our doors. We should not be attacking clinics like Stanton or proposing anti-woman legislation, but rather we should be standing with these women who seek our services. And it's important for this committee to note, since 1980, the abortion rate has fallen by more than 50%. During the same time, women have succeeded on a variety of educational and economic metrics. If women are gaining educationally and economically at a time when abortion rates are falling, it's pretty clear that women do not need to rely on abortion to succeed. The overturning of Roe on June 24th sent shockwaves through our nation that will take us months and perhaps even years to process. However, if we are truly committed to justice and women's rights, we can come together as a nation and find creative solutions to empower and stand with women in a post-Roe America. Once again, thank you for the invitation to share about the critical work of Stanton Healthcare and the amazing women we serve. Thank you.
Thank you. We will now begin a round of 5-minute questions, and I ask my colleagues to please keep track of your clock and stay within those 5 minutes. Dr. Brandy, I'm going to start with you. Across the country, states that protect abortion rights are preparing for a surge in patients coming from states where they no longer have the right to access the care that they need. Researchers estimate that 36 million women of reproductive age will now live under abortion restrictions and bans. In my home state of Washington, clinics are expecting to see 5 times as many out-of-state patients, and this is really a full-blown healthcare crisis that is going to cost women their lives and their health because they can't access the care they need from their own doctors in their own states. I want to thank you for providing such incredibly important care because the work you do is essential and it saves lives. Talk to us about how abortion bans in other states impact your work as a provider in New Jersey and the care that your patients receive.
Thank you so much, Senator, for the question. You're right. There's going to be millions of people that hopefully will be able to access care, and unfortunately will be leaving their homes and their communities in order to do so. I'm very fortunate to practice in New Jersey, where our governor and legislators have passed proactive laws to help protect the care in our state. Unfortunately, that's not the case elsewhere, and many people across the country will be leaving their communities to get that care. What that looks like is delays in care, which leads to patients presenting often later in pregnancy. It means patients may not be able to get to us because all of the logistics of travel, like childcare, like making sure people have days off of work, they have gas so they can get to their appointments, all lead to people not being able to access the care. And we know that that disproportionately impacts people of color and other people that are marginalized. People that live in states that the care is protected often are anticipating an upflow in people. People are going to be having to wait that live in those communities for weeks, and we're already seeing that in certain communities that appointments are taking 2-3 weeks to be able to get that appointment. And unfortunately, in pregnancy care, weeks matter, and that may create further barriers to people being able to access the care that they need and deserve.
Thank you. Ms. Detzer, thank you for sharing your story and your mom's. I know it takes a lot of courage to speak out about a personal situation, and I'm really grateful that you were willing to do that today. You spoke really powerfully about your mom's experience before Roe and what happened to her, and your experience in what you happened in a world where we had Roe. Talk to me a little bit about what abortion rights means in your life.
Thank you once again for the opportunity to share my story, Senator. The first thing that comes to mind for me is that what a person does with their life after they have an abortion need not be exceptional for that abortion to be necessary. What they do with their life after that should be the same as the choice to have an abortion, entirely up to them. However, in my case, I'm pretty proud of the things that I've done in my life after having an abortion. Most importantly to me, having an abortion allowed me to be a support system for my brother and my sister when they became parents, when they chose to become parents. And I would say, probably most importantly to me, that having an abortion allowed me the time and resources to care for my mother as she got sick with cancer and eventually died. And so I am deeply grateful for the abortion that I had that allowed me to live my life as I wanted it to.
Thank you. And Dr. Taylor, as you mentioned, this crisis is not being felt equally. Black and Native American women, for example, continue to experience disproportionately higher rates of death related to pregnancy or childbirth. How will the overturning of Roe exacerbate the maternal mortality crisis in our country?
Thank you for the question, Senator Murray. You know, it is going to greatly exacerbate our maternal mortality crisis in this country. You know, based on research that was conducted not too long ago, we know that the fall of Roe will, you know, cause our overall maternal mortality rate to increase by 20%. For Black women, it'll increase by 40%. And I think it's important to talk about the maternal mortality issue in this context because it's bigger than even the conversation we're having today. Black women disproportionately are impacted not only by, you know, the maternal mortality crisis, but also not unable to access abortion even before Roe. And so these challenges are going to be, you know, basically insurmountable in a lot of ways. But as I mentioned in my testimony, there are solutions that can be implemented to address the issue.
Thank you very much. My time is up. Senator Marshall.
Thank you again, Chair Murray. You may hear the abortion lobby say that maternal mortality is up to 14 times more for carrying a pregnancy to term as opposed to an abortion. But in absolute terms, the chances of dying from pregnancy is approximately 0.024%, which, let me be very clear, is unacceptable. It's too high of a rate. Before Dobbs or after Dobbs, it's too high. Let me also point out that more women ages 20 to 44 die each year from trauma, cancer, heart disease, suicide, homicide, liver disease, diabetes, and stroke than pregnancy-related complication. And finally this, please realize that HHS does not require actual reporting of abortion complications. While the abortion industry is quick to claim that eradicating all protections from the unborn is the only way to lower maternal mortality rates, abortion is not the solution to this crisis. Rather, the nation should focus on addressing the underlying causes that lead to maternal mortality. Here in our nation's capital, for example, has the fewest laws protecting life in the womb compared to the other 50 states, but its mortality rate of 36 per 100,000 means that women in D.C. are 50% more likely to die from pregnancy-related causes as women in the rest of the nation. For Black mothers, the situation is even worse, and according to Maternal Mortality Report of 2019, Black women accounted for 90% of all pregnancy-related deaths in the districts. The maternal mortality rate for Black mothers in D.C. is 71 per 100,000, dwarfing, tripling the national average. And it's especially a problem here in D.C. wards 7 and 8. If I describe this particular geographical area, they have no hospitals with birth wards. They only have 3 grocery stores and drastically fewer pharmacies than the other wards. These are issues we can and must address. Each time we spend taxpayer dollars funding the abortion industry, we take away money and resources from providing real solutions for mothers and our nation's most valuable resource, our children. Ms. Swindell, if you had a clinic in D.C. in this high mortality rate, how could you impact the maternal mortality rate?
Oh, we would definitely have an impact. Thank you for that question. You know, Stanton Healthcare, we are a nonprofit, life-affirming women's medical clinic. We don't charge for any of the services that we provide, and we have a very high focus on pre- and postnatal education, a very high focus on quality prenatal care, and then also putting together an individualized care plan for every woman who walks through our doors. And so we make sure that she has a solid support system, that she has all of the resources that she needs, that there is a plan in place. And our program runs the duration, it's 9 months of pregnancy, whatever that point is that she comes to our center, and then a minimum of 9 months after that. So it's an 18-month program, and it even goes beyond that. We have moms that come in that their children, their babies, their Stanton babies, as we call them, are 10 years old now, 5 years old, and they still come in, and we are that support and resource for them. So we're seeing very good results through our individualized care program. Again, it's that focus on pre and postnatal education and good prenatal care.
Yep, thank you for that answer. I want to keep on this topic of this ill-conceived concept about abortion being safer than pregnancy. You know, first of all, stating the obvious, the mortality rate for the unborn baby is almost 100% in abortions and very low in childbirth. We also believe that continuing pregnancy is very protective of the mother and child, particularly when we think about suicide rates of women that have had babies versus the abortion women that have had abortions. We think about even higher incidence of trauma and murder for women that have had abortions as opposed to women who have bore their pregnancy and had children. Do you see many problems with post-abortion syndrome, emotional distress, suicidal because of the abortion?
Thank you, Senator. Yes, we do. In fact, Stanton Healthcare runs an after-abortion care program, and that support program is always full. We have women that walk through our doors that are very traumatized after having abortion. Most women experience both short-term and long-term physical and emotional challenges after an abortion. In fact, studies show that 1 in 4 women that undergo an abortion express feelings of depression, anxiety, regret, things that follow along with that, substance abuse to try and numb the pain, hallucinations of their child, nightmares. Women experience things like being very stressed out at certain time on the clock because that's when the baby, when the abortion happened and the baby was killed. And my own mother suffered from the pain of a past abortion. In fact, she only became suicidal after she had had an abortion. She was never suicidal before that. She also, may she rest in peace, passed away in 2016. But she always regretted her abortion, and she became a very big supporter of Stanton Healthcare so that other women wouldn't have to go through the same experience she did.
Thank you so much. I yield back.
Senator Hassan.
Thank you, Chair Murray and Ranking Member Marshall, and I want to thank all of our witnesses for being here today. We know that the end of Roe is not the final goal of anti-choice extremists. Their ultimate objective is to ban abortion nationwide. We have to hold the line against any efforts to enact a nationwide abortion ban and keep fighting to protect a woman's fundamental freedom. This is, after all, about whether women are allowed to make their own complex life and health decisions. Dr. Brandy, in the wake of the Supreme Court's decision, we're hearing extremely concerning reports about women experiencing difficulty getting critical emergency care related to pregnancy. As Senator Murray mentioned in her opening statement, 1 in 50 women experience an ectopic pregnancy, a life-threatening condition. Doctor, can you walk through what an ectopic pregnancy is, how it develops, and how it is treated, please?
Absolutely, and thank you for the question. As you stated, ectopic pregnancy affects about 2% of all pregnancies. And an ectopic pregnancy is a pregnancy that is implanted outside of the uterus, most often in the fallopian tubes, but it can be in the ovaries, it can be in the abdomen. This condition will never continue on to a normal pregnancy, and often it is life-threatening for the person that has that condition. I'll tell a quick story that I had a patient recently in the ER with an ectopic pregnancy, and minutes are critical in the ability to take care of that person. I talked to them in the ER, they were walking around a couple of minutes, and then 20 minutes later, by the time we're in the operative room, they were critical. Their vitals were dropping. I had to emergently do their surgery in order to save their life, and I'm really glad that we were able to provide that care in such a quick fashion, but we've seen a chilling effect in other states. It was reported in the New England Journal of Medicine how providers in Texas after SB 8 were confused. They didn't know what was safe. They didn't know what was, they had to make decisions about whether or not to follow their oath or protect themselves against potential litigation and criminal action. And so it's really heartbreaking to consider as a physician that I would have to hold back what I know is evidence-based care to intervene right at that moment because I'm worried about calling my lawyer and making sure that I can do that before I intervene.
Right, and so as you point out, It is both the uncertainty created along with the reality that seconds count when you're caring for a patient with an ectopic pregnancy.
Exactly right.
Well, it is clearly treatment for an ectopic pregnancy is clearly life-saving medical care, and politicians have no place in the doctor's office or in the operating room where a doctor should be able to provide care quickly and safely based on best medical guidance. One more question for you, Dr. Brandy. The Supreme Court's decision created countless legal questions that have brought uncertainty into hospitals and clinics, as you've just pointed out. Reports indicate that confusion has interfered with treatment for a number of conditions, ranging from rheumatoid arthritis and IUD insertions to miscarriages. Dr. Brandy, could you outline why this confusion is harmful in a medical setting?
Sure. We spend years and years of our lives as physicians training on the right management for the right condition, to be able to diagnose and intervene right at the minute that that patient needs that care. Medications are complicated and can treat multiple disease processes. For example, as you mentioned, methotrexate, which is a medication we use to treat ectopic pregnancies, and back in the day used to use for abortion care, also treat things like rheumatoid arthritis and lupus, which disproportionately impact women. And so there's confusion now between providers or pharmacists about what medications they can provide for patients. There's a lot of overlap, for example, in miscarriage management. It's the exact same medicines, the exact same procedure as abortion care.
Right.
And so it's unclear if providers can provide that care under these very confusing regulations.
Thank you very much, and thank you, Madam Chair. I think it's clear that these decisions are best left to women and their healthcare providers. Thank you.
Thank you. Senator Cassidy.
Thank you all. It's kind of with, I'm a physician, and it's kind of with grief that I come to this because there's so much misinformation put out. But let me first say that we have a lot of common ground here, a lot of common ground. First, let me just say what's actually been accomplished or things that I personally have been involved with. I've led and has been signed into law the John Lewis National Institute on Minority Health and Health Disparities Research Endowment Vitalization Act and Maternal Health Quality Improvement Act, two things designed to address disparity. Working on legislation called the Connected Mom, allowing a woman on Medicaid to be at home and have her vital signs measured remotely as opposed to perhaps taking public transportation to and from the physician. We've worked significantly on what to do about addiction services, knowing that many women who die within a year after a pregnancy die of addiction. Working on, we just passed a major suicide bill, a mental health bill, which again, since many women who die post-pregnancy die of suicide. So, but there's more to do. And I emphasize that because there's common ground. And the common ground gets kind of lost in the midst of a cloud of misinformation. Now, again, I want to speak as a physician because I found that when patients came to me in a panic, the first thing I had to do was kind of dispel their fears that were not the case and to try and instill facts where there was instead this kind of, oh my gosh. So first, I think Dr. Marshall did a wonderful job of pointing out that he, as a pro-life physician, takes care of patients with ectopic pregnancies, period, end of story. So when we hear dialogue that somehow a woman with an ectopic pregnancy will not get her care, it's just not true. Can we dispel that? And when folks say, oh, those states that have the most restrictive abortion have the highest maternal mortality, no one speaks of Washington, D.C., which has the highest maternal mortality and has absolutely no limit upon abortion access, up to the point of parturition. The baby can be coming through the birth canal here in Washington, D.C. and can be aborted. 5 minutes, it would be a child in someone's arms. And instead, 5 minutes early, it's dismembered, its skull crushed, and they have the highest maternal mortality in the nation. And my gosh, if there's anything to fear, Ms. Swindell, in my home state, I happened to visit one of the crisis pregnancy centers. It is amazing the good work they do. And people come there voluntarily. They can leave at any time. They elect to stay. And when I went there, they had a whole closet full of clothing and formula. And I said, well, I thought you were prenatal. And they said, no, we continue to care for the family and the child after the child is born. And we have all these that are here for that family. Now there's federal legislation being introduced that would shut down crisis pregnancy centers, that would say, Ms. Swindell, no matter what your good work, Washington, D.C. is going to shut you down. I will also say, my gosh, there's all this kind of implication that Washington, D.C. is bearing down on people's lives. There is federal legislation to ban crisis pregnancy. Democrats want to force pro-life physicians and nurses to either do abortions or lose their license or have faced civil penalties. So, Dr. Marshall, you're pro-life. If you decided, no, the heavy hand of Washington, D.C. is going to come in and snatch your license away or subject you to civil penalties, that is concerning. Can anyone, now next, can anyone name a state in which there is a law saying that if the life of the mother is at risk, the woman does not have right to an abortion? You can't, because there is no state. Every state allows an exception for the life of the mother. And there's this kind of, frankly, misinformation that that is not the case. So I'm going to speak as a physician. There's a lot of common ground. Let's do something about maternal mortality. But let's don't hide our efforts in a cloud of misinformation, suggesting for a fact that aborting every baby is the way to protect mama's lives, when we see here in Washington, D.C., with the most liberal law in abortion in the nation, having the highest rate of maternal mortality. Nor let's suggest that a mama is going to have her life placed at risk because of these, or because of an ectopic pregnancy, she can't have her abortion addressed. And the richest was that transgender is somehow going to be affected. There's not a law out there related to abortion that also relates to transgender. So I usually ask questions, but here I just had to say, let's all think like doctors who really want to lower maternal mortality, but also calm everybody down with facts, not with misinformation. With that, I yield.
Senator Smith.
Thank you, Madam Chair, Ranking Member Marshall. Dr. Taylor, I want to just turn to you quickly. Could you quickly respond to this myth of post-abortion trauma and suicidal thoughts? Maybe also just quickly address some of the systemic causes for the vast disparities in maternal mortality in this country.
Sure, absolutely. You know, based on how I talk about maternal mortality, I center Black women in the work that I do. And, you know, the maternal health crisis is, the root of that is racism. How we see structural racism not only show up in the healthcare system, but I think also broader society. We know that racism, particularly the experience of it for Black people, causes us to, you know, be more susceptible to disease, mental health challenges, in addition to physical health challenges. And so we do see that show up sometimes in the context of, you know, the care that pregnant women may be undergoing. I think a part of it is too, you know, Black women also have reported experiencing not being listened to by their healthcare providers. So when they express pain or discomfort in some of their exchanges with physicians, that is sometimes ignored. We even saw Serena Williams share her own story of what happened to her and not being listened to shortly after having her daughter. And so to me, those are some of the root causes of the maternal mortality crisis. And look, I recognize that, you know, pregnancy in and of itself, no matter how you decide to move forward, that is a decision based on the woman and her family in consultation with her physician. And that can spark, you know, some challenges for her mentally because it's a difficult decision. But I don't think that it's true to say that, you know, for the most part, women who stand firm in their decision to have abortion are regretting that or, you know, experiencing mental health challenges because of that.
It's fundamentally a question of who has the decision, and the ability to control your own decisions in your own life is really what this is about, it seems to me. I'd like to turn to you, Dr. Brandy, and turn to the question of medication abortion. So medication abortion has been a safe and effective way of terminating a pregnancy in the first 10 weeks for nearly 20 years. A provider can safely prescribe medication abortion through telehealth in most cases, and it can be delivered through the mail also. Slightly over half of abortions in this country are done with medication now. But now that the Supreme Court has overturned Roe, this medication will be a crucial access point for many women. We cannot allow Republican politicians to spread misinformation about this medication, which is happening, or to erect unnecessary hurdles to stop women from access. So, Dr. Brandy, can you just tell us, is medication abortion safe and effective for women to use in the first 10 weeks of pregnancy?
Senator, that's an easy one. Absolutely.
Thank you. And can you just walk through a little bit of the process for how providers determine whether medication abortion is effective per person?
Sure. When I see a patient that is seeking abortion, I always go through all the options and talk about risks and benefits. Particularly around medication abortion, there are very rare contraindications to receiving medication abortion, but generally it is incredibly safe. It is anywhere between 95 and 99% effective in ending a pregnancy up to 10 weeks. And it is something that requires very few interventions from the healthcare system. Many people can determine based on their last menstrual period when they became pregnant. And based on that and their symptoms, patients can be provided this medication over the phone via telehealth.
So it's not medically necessary for a person to be prescribed this medication by a physician in an office?
Not in an office setting, no.
Yeah, thank you. So I want to just be clear about this. Medication abortion cannot alone undo the damage done by Republican politicians who are taking away women's freedom. And today we know that there are states that are undermining the capacity of people to access medication abortion, but it is an important access point to protect access where we can, and to actively fight this misinformation, I think, is an important thing for us to do here. I am sorry that I am out of time here, but I want to just follow up briefly on the line of questions that Senator Hassan asked, which was to really to illustrate the chaos that is ensuing around this country as a result of this extremist Supreme Court decision to take away this fundamental freedom of people, and what we see from Republican lawmakers determined to control the decisions that women want to make based on where you live. The right and freedom of women to get an abortion, to manage their miscarriages, to treat an ectopic pregnancy is now severely compromised. This legal chaos which has ensued means that your doctor may not even believe that they have the autonomy to decide and to practice based on what their best medical information is and what they believe is best for their patient. So let's be clear. Let's be clear. Republicans are responsible for this chaos. They created this healthcare crisis because they believe they know better than women whose lives and stories they will never know. They believe that they know better. They believe that they should control. That's what we are now faced with. That's what we are now working to fix. We will not stop working until women's freedom can be exercised equally in all parts of this country. Thank you, Madam Chair.
Senator Braun.
Thank you, Madam Chair. Listening to Senator Smith's point of view there, I think as we do give it, this is a topic that I think for 49 years has been in one place. It's now come to another. And I think we got to be careful that we don't get too caustic in either point of view. Right now, the Supreme Court says it's back with the states. I've been a believer on this issue from the get-go. You do not demonize the folks you disagree with, and you make sure that in this case, when we have returned this to the people, we make the right decisions at the state level. I'm going to have the same question, and I'm going to start with Ms. Detzer. You were quoted on September 17th, 21, on Fox 13, Seattle News, that you have not looked back except in celebration and deep appreciation for your choice. And again, respect that. I'd like to ask you, though, when it comes to when your state grapples with it, at what age do you think gestationally it's no longer appropriate to have an abortion? Just a simple question, and I think that any of us, if we're out here talking about the issue, especially in states where it may go beyond where it's commonly accepted, I'd like to know your opinion.
sorry, Senator, could you repeat your question, please?
You and some of the organizations you support support abortion, I believe, up until the moment of birth. And I'd like to give you the chance to clarify that, if you think that's still where it should be, or if there is an age beyond which you would not be comfortable with an abortion.
I am not a medical provider. I have no standing to make any statements about medical limits. What I am here to do is to share with you all my personal story of abortion access and to highlight how my mother's story of abortion access was so very different and how much changed in just one generation between us.
So putting a medical issue aside and assuming there was none, is there an age beyond which you would be uncomfortable with an abortion?
I'm sorry, are you asking me to consider an abortion not a medical procedure? Because I believe that it is health care.
Taking the inherent risks of an abortion aside, and if it's minimal, do you think there's an age beyond which you'd be uncomfortable with it?
I'm sorry, could you please repeat that question? I'm not sure how to separate health care from an abortion.
So you're making that point, and I'll let you rest on it. I'll go to Ms. Brandy with the same question.
Excuse me, Senator, are you asking me a question? Or are you asking
Same
Brandy
question
a
I asked Ms. Detzer.
I apologize, I was confused. I'm Dr. Brandy, thank you. I think what you're trying to bring up is abortion care later in pregnancy. And I understand that people have very different opinions about what that looks like and how they feel comfortable regarding different gestational age limits. But I think talking about these hypothetical scenarios doesn't actually respect the pregnant people that I take care of every day that have varying circumstances. And as a physician, I think the most prudent thing is to listen to their stories, assess their own medical risks, depending on where they are in pregnancy, and help them decide what's best for them. I think bans based on a gestational age, whatever that gestational age is, just create barriers to care and don't actually improve the safety of care, which is what I care about most for my patients.
You know, being a doctor, I think you may have a better way to answer the question in the sense that I know there's medical risk in doing anything. At the point, you can't eliminate risk, but to where, say, there would be as little as you could determine at the time, do you still think it's appropriate for someone to choose an abortion up to the point of birth?
Senator, again, that hypothetical that I think is brought up quite a bit actually is not what abortion care looks like on a day-to-day basis. Abortion care after 20 weeks is about 1% of pregnancy. And I think by focusing on that, you delegitimize and you disrespect a lot of the patients that are seeking this care for very legitimate and important reasons.
Ms. Swindell, would you like to weigh in?
Sure. I believe in what all the medical textbooks say. I'm not a medical professional, but life begins at the beginning. And there's an amazing spark that occurs when the sperm and the egg meet and a new embryo is formed. And I believe in respecting all stages of life and development. I think that's an important part of human rights and also women's health care. And so I believe in what the medical textbooks say. I believe in biology. I believe in science. And frankly, it's not rocket science. Life begins at the beginning. And abortions at any stage take the life of an innocent human being. And that is a grave human rights violation. I was born after 1973. I was born in 1976, aging myself here. And I was open prey in my mother's womb. My government decided that I had no constitutional rights or human rights or civil rights. And it's a new day and it's a new era, and preborn children, their humanity is being respected. And it's a great thing.
Thank you, and I respect all of your opinions and ask the question because of how difficult it is to answer and why this should be left with the states, with the people within the states to make that decision. When you look at
Senator Braun, your time.
yes, and I'll finish up here in just a moment, with that diversity of opinion. So thank you for your answers.
Senator Hickenlooper.
Thank you, Madam Chair, and thank all of you for your service and your willingness to come here today. I grew up, I was born in 1952, so the issues around abortion were of intense discussion, obviously, in those days. And my mother was a single mother, raised 4 kids by herself, and we discussed frequently the issues surrounding abortion. And this was kitchen table discussions. It was my mother's, no matter how lean our household budget may have been, she tried to give every year some donation to Planned Parenthood. Some years it was $10. But she felt that a woman who was forced to carry a child to birth that they were not ready for, that they didn't intend, was being forced to give up part of their life and to have challenges and obstacles that would make their achievements in life far, far more difficult and oftentimes would lead to devastating results. Colorado's a state where we proudly support a woman's right to and access, the right of access to health care. But we are surrounded by states on 3 sides that have either or are going to or expected to enact abortion bans, and we will certainly see a large influx of patients. I think this can stretch the providers in Colorado and other states that are already quite thin. It's going to impact access, not just to abortion, but to other reproductive services. So, Dr. Brandy, I'll start with you. How are these abortion bans impacting access to other reproductive health services, like contraceptive care, cancer screening, et cetera?
Thank you, Senator, for the question. You're right that while abortion bans on face value just impact abortion, they impact so much of reproductive health care and care that's entirely unrelated to reproductive health care. Things like we mentioned earlier, different immunologic diseases can be impacted because treatments are very similar. Or, for example, cancer cases where people may get delays in their care or may have contraindications to certain types of birth control that may not be accessible to them. There are so many ways that this is impacted, ways that medical physicians and other healthcare professionals knew about and were seeing through Texas. But every day I'm hearing a new report about a different medication, a different patient scenario, because every patient's unique. Every patient is an individual, and we in medicine have to be creative sometimes when we take care of patients, find new ways to treat different diseases. And when our hands are tied, when there are certain bans that just create a law without thinking about the people that it impacts, it's really challenging for physicians to be able to meet that individuality of patients and give them the appropriate care that they need.
Great. Thank you very much. Dr. Taylor, I wanted to ask you also, in your opinion, what does this notion of government-mandated pregnancy or enforced pregnancy, what kind of outcomes is that going to lead to what kind of health outcomes is that going to lead to for women?
Absolutely. Thank you for the question, Senator. First of all, anytime we're forcing a person to continue with a pregnancy that they would like to terminate, it could impose various issues for that individual, whether it's stress, anxiety, mental health challenges. I think in addition to that, if we put this in the context of the, maternal health crisis in this country, it could mean that that individual, may not keep up with their prenatal care appointments. They may also struggle financially if they have to continue with a forced pregnancy. We also know that even if you look at something like higher education, we know that for a woman who can access an abortion, a college-age woman, that she's more likely to finish school. And so it really has an impact on the broader consequences of that person. I think another point I'll add too is that about 60% of people who have abortions are already parents. And so not having the opportunity to terminate a pregnancy for a woman and her family could mean that she is unable to care for and support the children that she already has. It could impose additional economic challenges for the broader family and could even lead to health challenges for the children that she already has. So it really is a broader issue that can impact various aspects of a woman's life.
Thank you very much. And just one last very brief question, if I can. I saw a number, heard a number last week that almost half of all pregnancies in America are accidental or unintended. Is that true? Is there any of you have that accurate number on that?
I can speak to that. Yes, about 45% of pregnancies are unintended, and about 40 or about half of them end in abortion. And so even though we talked earlier about percentages being very small, if you think about percentages on the broader sense, like the 14% of people, that's actually equatable to thousands of people that can become pregnant in our country. And so that's a huge impact for people across our country.
Okay. Thank you all.
Thank you.
Thank you.
Senator Murkowski.
Madam Chairman, thank you for the hearing today, and to our witnesses, thank you. I've had an opportunity to read your stories in your testimony that you've provided to the committee, and I've heard many stories from Alaskans, most notably in this past couple weeks, from women who are really very distraught about the Supreme Court ruling in the Dobbs case. But the stories that you have shared, from a personal decision to terminate a pregnancy, to the challenges that parents or family members face in accessing care, to the stories that women who visited clinics such as Stanton and decided to continue a pregnancy. I think they all demonstrate how these are very deeply personal, deeply complicated, and of course incredibly challenging decisions that far too many women face each year, and clearly that Americans hold deep and conflicting convictions over. When it comes to decisions that are so personal, that are so complex, and have such an impact on a person's lives, I think that choice must ultimately be in the hands of the individual and not in the government. And that's where I came down on vaccine mandates. It's where I come down on abortion. But I think that, like so many other areas, there are nuances, there are gray areas. Many Americans, myself included, believe that it is reasonable to not require those who are firmly opposed to abortion to support it with their tax dollars, and that providers who do not wish to be involved in abortion should not be forced to be. But what I would hope that we can agree on is that it's in the best interest of everyone to create a system where fewer women face this choice in the first place, because everybody has adequate access to and knowledge about contraceptives, and because women and families have the support that they need. But ultimately, I believe in limited government, individual liberty. I support a woman's right to make her own health care decisions, and that means reproductive health care. I'm working with a small bipartisan group to ensure that the rights that women have relied on for the last 50 years, as established in Roe and in Casey and in Griswold, that these are protected. And I hope that at a minimum our legislation will demonstrate that there is a majority in the United States Senate that supports these basic rights. And I know that folks are all well, how are we going to get this legislation passed? And so kind of the knee-jerk response here is to take on the filibuster. And I want to just raise this because I think that it's tempting to call for the removal of the filibuster so that we can do something. But I would ask my colleagues to take the longer view and think about what elimination of the filibuster would mean for both sides and for our country in the future. In the recent years, the filibuster has been used multiple times to block attempts to restrict access to reproductive health care. 3 times, in 2015, 2018, and then again in 2020, pro-choice senators used the filibuster to block a 20-week abortion ban. It was used to stop a blanket ban on funding for Planned Parenthood in 2015. There were numerous other times to prevent the erosion of reproductive rights. I think we've got to look at this again down the road. The balance of power in Congress moves back and forth. Without the filibuster, do we really believe that a different majority would not seek a nationwide ban on abortion and find a way to succeed in enacting it? The filibuster is really one of the few mechanisms that protects the rights of the minority. So I raise this because I think we need to be looking long-term at this. Now, this hearing is about reproductive care in a post-Roe world, and I want to ask you, Dr. Taylor, what does this mean? What are the downstream impacts that we should expect on access to care outside of abortions, even in states where the Dobbs decision will not have an effect? In Alaska, our courts have held that our state constitution protects access to abortion. But at the end of May, Planned Parenthood Clinic in Soldotna closed its doors. They do not provide abortions. The Dobbs decision, again, is not going to impact our state, but what we heard was a Planned Parenthood spokesman said that the closure was a result of a review by Planned Parenthood that led to the closure of 5 clinics nationwide. They're basically looking to reduce their budget to prepare for changes in states with trigger laws. We don't have one of those. Now, the closest Planned Parenthood location to Soldotna is in Anchorage, as is 3 hours away. The closest source of Title X comprehensive reproductive care is Homer, 2 hours away. So we're seeing changes like this in a state like Alaska that is supposedly not going to be impacted because of our constitutional provision. But you've got trigger laws in states like Kentucky and Idaho that are driving a reduction of access to birth control and reproductive care as far away as a state like Alaska. I haven't allowed much time for the response here, but it is a concern to me that the reduction to access in care is going to result in more and not fewer unplanned pregnancies. So
Senator Murkowski.
I asked the question of Dr. Taylor, and I said
Dr.
that she's no
Taylor has
longer there.
left momentarily. She'll be right back. We can ask her for a response in writing or have Dr. Brandy.
Maybe Dr. Brandy can address that. Thank you. I didn't realize that she had vacated the chair there.
Sure. Thank you for the question, and happy to answer. You're absolutely right that there will be downstream effects, and we will not know truly all of the effects that will impact things like maternal morbidity, mortality, unplanned pregnancy rates. We won't know that for years to come. But I think it's important to name that we have a health crisis on top of already a health crisis through COVID. That many labor and delivery wards across the country, for example, have closed because they were unable to keep their doors open. And so thinking about an influx of people that may be seeking maternity care, do we have the support systems? Abortion and maternity care are not mutually exclusive. I'm an OBGYN. I take care of both patients. Not often patients are the same patient. And so it's important to recognize that things like maternity care, labor and delivery, and having access to nearby clinics in the communities that are needed are both issues that need addressing.
And we've gone
will
way
have
over
long-term
time
impacts.
on Senator Murkowski, so I'm going to move on to the
Thank you,
next
Madam
senator.
Chairman.
Thank you. Senator Rosen.
Thank you, Chair Murray. You know, this hearing really comes at a critical time. I appreciate the thoughtfulness of the senator from Alaska, how she is working in a bipartisan way to help us move forward on this. So thank you. But nonetheless, the Supreme Court's decision to overturn Roe v. Wade, it does take away a woman's right over her own body, and it is going to hand it to anti-choice politicians. In states like Nevada, Access to reproductive care, health care remains protected, but the threat of a nationwide ban is real, and it will have dire consequences. It's why I'm going to continue to call on President Biden to take all executive actions he can to protect reproductive rights, to protect women's lives, and it's why we need to ensure a total ban on abortion never becomes federal law. And so all of us here have been discussing extreme abortion bans and anti-choice politicians rolling out these rigid bans across the country, forcing women to carry pregnancies against their will. We've seen some laws so extreme, they don't even have exceptions for rape or incest. So I know we're at the end of towards the end of a long hearing, and I have a few questions. So Dr. Brandy, maybe we'll just have a discussion about how the total lack of exceptions, these very rigid state laws, how it's harmful to women, how it creates a unique burden on someone like you, an OBGYN, the patient and the doctor, waiting till somebody is moments, perhaps, from death in order to take care of them. Can you just speak a little bit about that? I have a few other questions on this. I thought we'd maybe have a discussion.
Thank you, Senator. I would love to have a discussion on this. I think it was mentioned before that there are exceptions for the life of a mother. And so, of course, that is okay. That's great for our patients to make sure that they're safe. But the problem with the very few restrictions, or the very few allowances for being able to provide abortion care, is that it doesn't take into account the individual circumstances of that person. And what we're seeing across the country now in places where abortion is banned, except for life of the mother clauses, is that people don't know what that means on the ground. Doctors don't know what that means. Ideally, as a physician, if I have a patient that has an illness, a condition, I want to be able to treat it right then and there. I don't want to wait a couple of hours or a couple of days for conditions to get worse. And many doctors across the country are asking, how bad does it have to be?
Where's this thin line? And where's the thin line between life and death for both? For both the mother and the fetus. You talk about this. What about in cases of severe anomaly where someone's forced to carry a pregnancy? Can you talk about that and how you're going to deal with that? Fetuses with a severe fetal anomaly. Pregnancy isn't viable, and it's really a threat to the physical and mental health of the woman.
Sure. And I think you bring up a good point around viability, which is a very common conversation about having gestational age bans, for example, that every pregnancy is different. Some pregnancies may be viable at certain gestational ages. Some pregnancies where the fetus has some type of anomaly may never be viable. And so when I have patients that have that situation where they have a fetus with anomalies, it's always a nuanced conversation about what are their goals for this pregnancy and what are their goals for their potential child. Do they want to continue a pregnancy and deliver and go through a labor process and watch that fetus, when it's delivered, watch that baby die shortly after? Or do they want to have an abortion and end the pregnancy earlier? I think that decision should be that individual person's decision. I don't think I'm able to make that decision for them, and I'm hopeful that people outside of their families, people like politicians, won't be able to make that decision for them either.
Again, it's about individual liberties and right to privacy, but sadly in some states, women can face jail time, steep financial penalties, possibly the physicians, the nurses, friends or neighbors or family members who may help you. So what impact do you think these threats of jail time on everyone are going to impose on people?
Thank you for that question. I assume that most doctors didn't go to medical school to, wait to take care of patients, to delay care. All of us want to provide the standard of care. We want to provide evidence-based medicine and help our patients with whatever care that they need. And now physicians are being put in an impossible situation where they have to decide whether or not they want to follow their oath to do no harm, to protect our patients, or protect ourselves and protect, our families and protect our licenses. That's an impossible decision. Doctors care so deeply for our patients. I know I care so deeply for my patients. And it's incredibly hard to think about being in that position where I can't intervene because I have to call my lawyer first to make sure that it's okay, or that I'm going to wait and wait and wait until someone gets sicker and sicker because I don't know what that law means. And we're seeing that across the country. I'm hearing stories from all over, from physicians that are withholding life-saving care because they don't want to go to jail. And that's really not how healthcare should work.
An incredible burden on, you're right, for the physicians and healthcare providers who care so deeply, and of course, for a woman and her family's right to privacy in these choices. Thank you, Madam Chair.
Thank you. Senator Murphy.
Thank you very much, Madam Chair. Thank you all for your testimony today, and thank you for this hearing. In states across this country that have imposed trigger laws and some of the most intense restrictions on abortion, there also tend to be the fewest services available for women and families. Run through the list of states that are in the midst of criminalizing abortion, and you will run into states that have refused to expand Medicaid under the Affordable Care Act, leaving women and families without access to the basic health care that is necessary to raise a child today. Survey the states that have had on the books these trigger laws, and you will find states that have not passed any meaningful family leave or medical leave legislation, leaving parents with no option but to have a baby and to immediately go back to work, to be able to afford that health care that isn't being paid for because of the lack of Medicaid expansion. Dr. Taylor, could you just talk for a second about the consequence of a policy of forced pregnancy in states that provide no meaningful access to health care and parental leave, the kind of policies that you would think states that are so interested in more pregnancies would have invested in? What's the consequence of that?
Sure, absolutely. I think the consequence is that we leave moms and their families out to dry. As you mentioned, it's so essential for a family to have access to affordable childcare, affordable health care, access to nutritious foods. I mean, we can run down the list. And unfortunately, in these states that are also banning abortion, they don't have those supports available to these families. I think another point to lift up here, too, is that, these are all situations that are going to disproportionately impact women of color and who are already experiencing challenges, whether it's in terms of their financial outlook, housing insecurity, poverty. And I think the conversation around, providing services or providing diapers or maybe even formula, if you can get your hands on it in this moment, temporarily is not going to do anything to support those families over the long term.
Dr. Brandy, I wanted to talk to you about another issue, an issue that the Senate may take up later this week. Listen, this is all about putting government in a position of control over women and their bodies. But apparently it's not enough to tell women when they can bear a child. It's not enough to dictate to women when and how they can access health care. Now we're going to also dictate to women where they can travel to get health care. Because all throughout the country, there are state legislatures getting ready to take up pieces of legislation that would eliminate the ability of individuals, in this case women, to be able to travel where they want for health care in this country. Just another mechanism of controlling the decisions that women make, government being in charge. One piece of legislation in Missouri contemplates legal liability for anyone involved in interstate healthcare travel, including the person who works at the call center to help set up your appointment would now be legally liable, would potentially be dragged into court, have to hire up lawyers in order to protect themselves. So I'm interested in your perspective as a provider, right? This world that we're entering into, in which all of a sudden, not only are you not going to be able to travel across state lines to obtain health care, but that everybody in the business of health care is now going to have to shut their doors to people who simply want to travel 10 miles from one state to another in order to get health care. What does that world look like?
Thank you for the question, Senator. I think it's a really scary world, what that potentially will look like and what we're already seeing now, that people are trying to travel to get care. I don't want to be checking people's licenses to confirm their address to know where they come from before I can intervene. Doctors, healthcare providers just want to do our jobs. We just want to take care of people, whoever shows up at our door. But at the same time, we want to make sure that our clinics and our staff are protected from these arbitrary laws that are trying to chill our ability to provide healthcare to people. And I'm also just heartbroken that people have to leave their communities to get the care that they need. Not just for those people that are traveling thousands of miles, if they can even travel at all, but also for my friends, my colleagues that are out of jobs right now, that have the skills, they have the medicines to be able to take care of people in their communities and are not allowed to. All of that is heartbreaking, and that's all not how healthcare should work.
Great. Thank you, Madam.
Thank you. Senator Baldwin.
Thank you, Madam Chair. I would like to use some of my time this morning to highlight the words of Dr. Kristen Lyerly, who is a board-certified OBGYN and abortion care provider in Green Bay, Wisconsin. She says, imagine sitting in an exam room with your doctor, explaining a very personal problem that is affecting every aspect of your life. And your doctor looks you in the eye and says, I know how to help you, but I can't, because the politicians in our state won't let me. Physicians in Wisconsin have been forced to stop practicing medicine because of our state's restrictive abortion ban that was signed into law in 1849. You didn't hear me wrong, 1849. That was 70 years before women even had the right to vote. Instead of providing care to patients, they have to turn patients away or consult with their lawyers, delaying critical care and wasting precious time. So, Dr. Brandy, what is the impact of delaying care in these critical situations?
Thank you for the question. Delaying people's ability to access that care or delaying interventions in life-saving situations can be the line between life and death for some people. As stated earlier, it's very unclear what these laws mean for providers on a day-to-day basis. For example, and I apologize if I'm getting too technical, but let's use the example of someone breaks their water at 18 weeks, 19 weeks. It is very unlikely that pregnancy will continue to term or will have a good fetal outcome. But it's unclear based on this law with protections for the life of the mother, when are we allowed to intervene? Is it at that moment when typically I would have a conversation with that patient about what they want to do? Is it when that broken water creates an infection? Is it when that patient becomes septic? When they're in the ICU in shock? It's not written down anywhere what we do because we want to follow the standard of care, and that would be to intervene at that moment. But these laws don't really specify, and it's very confusing for the people on the ground that are trying to figure out, well, when can I intervene? And while waiting, this patient is getting sicker and sicker when they don't have to. That's not evidence-based care, and that's a scenario that many doctors are in right now.
Thank you. Dr. Taylor, can you describe how barring physicians from providing abortion care impacts access to other sexual and reproductive health care services? So, for example, how does this affect families and affect those who are pregnant or looking to become pregnant?
Sure, absolutely. What comes to mind with this question is, you do have some providers that are in situations where they're providing maternity care as well as abortion care. And so if they have to shutter, that means that the women in that community will not have access to the prenatal care that they need. We have seen this at the Century Foundation in particular. We work with community-based organizations that are actually run and led by women of color serving the community on the front lines. And some of those organizations are providing services both for abortion and maternity care. And so any facility that has to shutter its doors, that's going to impact the comprehensive set of services that are available to folks in those communities.
Thank you. Dr. Brandy, this is for you also again. Wisconsin's law provides that when an abortion is necessary to save a patient's life, this decision must be signed off on by 2 additional physicians. I'll add that in Wisconsin, not even a cancer diagnosis or treatment for cancer falls under the exception for saving the life of the mother. That means in Wisconsin, 3 physicians have to come together, possibly in an emergency situation, to decide if a woman's life is worth saving, because it's now required by the legislature in the state of Wisconsin. On Monday, the Biden administration released updated guidance on the Emergency Medical Treatment and Active Labor Act, or EMTALA, reminding doctors that they must terminate a pregnancy if doing so is necessary to stabilize a patient in an emergency medical situation. I want to thank the administration for this guidance, but I know that it is not a complete solution for the political interference that doctors are experiencing, and we need legislation for that. Dr. Brandy, can you explain why burdensome requirements to administer emergency care are so harmful?
Thank you for the question. And just to briefly explain, EMTALA protects patients from being turned away from hospitals and emergent care settings, historically to protect people that were unable to pay. And so the requirement requires emergency physicians to be able to assess a patient and potentially stabilize that patient if it's an emergency situation, or transfer if that patient is unable to get the proper care in that setting. The problem with EMTALA and its use right now within the abortion bans that exist is, one, religious hospitals that may not provide abortion care can refuse and do not fall under the restrictions of EMTALA. And so many people seek care in these facilities, and even if they have a life-threatening situation like breaking water early, hemorrhage, they don't necessarily have to follow under those rules. And the other thing with EMTALA is that, again, we're in the scenario that doctors are going to have to figure out amongst themselves, and it may be different depending on what hospital you're in, what is the stabilizing condition? How sick does someone have to be to consider that they fall under EMTALA or not? And there are going to be different scenarios, just like you're explaining, that many doctors are going to have to come together and decide and figure that out. But it's unclear if we'll be protected. Like, how will we know if we're making the wrong choice?
Thank you, Chair, and thank you to each of the witnesses. Sharing your own personal experiences and stories is very important. And I want to share a story. I won't do as good a job as y'all because this is a Virginian story, but it's not mine. But I want to share it. It was a news article that, Madam Chair, I'd like to ask be introduced in the record from NBC News last week. Jamie Abrams, and I'll read an excerpt from this. What moving from Kentucky to Virginia after I was diagnosed with cancer reveals about Roe. After teaching Roe versus Wade as a family law professor, I experienced the stunningly painful irony of reading the leaked Supreme Court opinion in Dobbs on the day I was diagnosed with invasive breast cancer. Overnight, at age 44, I became a person who would need an abortion if pregnant because cancer treatments would compromise a healthy birth and delay needed cancer care. I also became someone like other hormone-positive breast cancer patients who was advised to discontinue hormonal contraception because it could stimulate the growth of cancer cells. In the aftermath of Roe's being overturned, supporters of the move want to pretend that abortion access can be surgically extracted from women's health care decision-making as a whole. Nothing can be further from the truth. Since the Dobbs leak, which has made it clear what the conservative-leaning court was poised to do, I have switched gears rapidly between being a reproductive rights scholar and a breast cancer patient. I also switched employment from Kentucky to Virginia at a time when a woman's constitutional right to bodily autonomy has been stripped away. This move across state lines and into a different area of women's health care has revealed a searing reality. We now live in a world of vastly divergent health care systems for women. When I was diagnosed with cancer, the last thing on my mind were pregnancy, birth control, and abortion. Yet nearly all of my medical appointments, tests, and surgery itself were predicated on controlling reproduction and being able to terminate a pregnancy if needed. Cancer care also requires that I share my reproductive medical history about prior pregnancies, the number of live births I've had, the medications I've taken, what surgical procedures I've had, and who my other providers are. I answer honestly, not worried now whether my answers are under surveillance by regulators or law enforcement. As a breast cancer patient in Northern Virginia, I have thankfully found unbounded compassion, empathy, dignity, privacy, and vitalizing human connection. But according to Kentucky's trigger law banning abortion, I would lose all decision-making autonomy and be subject to a doctor's discretion about whether an abortion was necessary to prevent the substantial risk of death. Is stage 1 breast cancer enough? Stage 2? What relevance are my 2 children for whom I desperately seek the best prognosis and longevity for myself? Does the law require me to endure the state-compelled progression of cancer? The answers to these questions would be entirely unclear. In reality, doctors would treat me under an amorphous cloud of state-imposed liability because the Kentucky law makes it a Class D felony to provide abortions outside these exceptions. I'd like to ask you, Dr. Brandy, I was very, very struck by this, and it strikes me that this is probably not an unusual concern or case.
Thank you, Senator, for the question. And you're absolutely right that I think many people before all of this happened didn't really understand the full impact of how this is going to radically change healthcare and put our healthcare system potentially into chaos. I know as a doctor, I live in the gray, meaning that patients don't read the textbook. They don't come in with a very clear-cut answer as far as what to do. All of our care is tailored to that individual person. And conditions like cancer have a unique treatment based on that individual person, and that involves the conversation about pregnancy options and whether or not to delay pregnancy or whether or not a patient should terminate a pregnancy if they're diagnosed with cancer or wait several months to get treatment.
The notion that we would say to someone with a cancer diagnosis, hey, you know, just move to another state. Mm-hmm. I mean, just move to another state. This author could do that. A lot of people can't. People of low income can't. People of color would have a harder time doing that. And the notion of the court in Dobbs that we'll just rely on your state legislature. State legislatures where women are dramatically underrepresented, where people of color are dramatically underrepresented. In Congress right now, 26% of Congress is women. That ranks us 76th in the world. We are below the global average of women in Congress. So the notion to tell somebody who is politically less powerful, oh, just rely on your legislature. Well, that's not going to give you comfort. That's why the 14th Amendment was passed, to protect people who the majority would not protect. Equal protection, even if the majority won't give it to you in the legislature, you're entitled to it. Protection of your liberty, even if the legislature won't give it to you as an American, you are entitled to it. I can't imagine a scenario where we're just going to be casually telling cancer patients and those with other conditions that they just have to lump it and move to another state.
Senator Casey.
Chair Murray, thanks very much to you and the ranking member for the hearing. I know we're out of time because or getting close to out of time. The vote has expired, so I'll be very brief. Dr. Taylor, I wanted to start with you, and in particular, I wanted to cite directly from your testimony. In the third paragraph of your written testimony, you say, and I'm quoting, black women are dying of pregnancy-related causes at 3 times the rate of their white counterparts, we are also most likely to experience severe maternal morbidity, unquote. That's what you said in those 2 sentences. How are these Americans impacted by the Dobbs decision?
Thank you for the question, Senator Casey. You know, Black women are, as you mentioned from those stats, more likely to experience maternal health challenges in this country. And I think the Dobbs decision is only going to exacerbate that. You know, for Black women who may choose to terminate a pregnancy, they may be living in states where abortion is banned and they are not able to do that. So if you think about that in the context of the fact that they are also more likely to die from pregnancy-related causes, you know, this decision is going to be incredibly dangerous for them, and not only for them, but also for their families. Another thing that I mentioned earlier today in the hearing is the fact that 60% of people who have abortions are already parents. Many of these women are already parents, and so this also has implications for their families. We also note that when a woman in the postpartum period, when she's able to access the health care that she needs, prenatal care that she needs, you know, she's also more likely to have healthy children, healthy infants. And so this is really something that's going to impact a Black family, overall any other family who may be in a situation where they would have chosen to terminate a pregnancy, but they are forced to continue on with that pregnancy.
Thank you, Doctor. And I'll maybe submit a question for the record for Dr. Brandy regarding miscarriage management and how this decision will affect your ability to treat the people that you treat, in particular the relationship with your patients, including for pregnancy-related care. If you want to respond briefly, but you can certainly amplify it for the record in writing if you want.
Sure, happy to respond now or in writing. I'll briefly say that, again, the management for miscarriage is the exact same management for induced abortion, same medicines, same procedure. And so if there are restrictions about what type of procedure to offer or what type of medication is allowed, it doesn't impact just induced abortion. It impacts all kinds of pregnancy care. And I want to be able to offer the standard of care, the evidence-based treatment that my patients deserve. And I don't think that legislation should be able to interfere with that, because that's what our patients need.
Thank you, Doctor.
Senator Marshall, do you have any closing comments or questions?
Yes, I'd like to ask a couple more questions if I could. Thank you so much, Madam Chair. Ms. Swindell, for years, Planned Parenthood has claimed that they are not focused on abortion, but provide a slate of services for women. Why then has Planned Parenthood closed a clinic in your home state of Idaho and has plans to do so in other states that have passed laws or plan to pass laws to prohibit abortions?
Great question, Senator. Yes, I think there's been at least 60 Planned Parenthoods and abortion clinics nationwide that have closed since the overturning of Roe v. Wade, which is interesting when you hear the argument that they are all about helping women and providing all these other services, and abortion is just less than 3% of what they do. Well, then why are they closing all their clinics down? Wouldn't you want to stay open to help women, whatever they're going through with an unexpected pregnancy, and to help navigate the current climate, or perhaps provide all those other services that you claim to provide? So the reality is they are in the abortion business. That's what they want women to choose. And so I think that's being exposed right now. My home state of Idaho, yes, the Planned Parenthood in Boise, right next door to one of our Stanton healthcare clinics, closed down. I do want to say that in Idaho, we have 8 pregnancy resource centers and life-affirming clinics throughout the state of Idaho. Now there are 2 Planned Parenthoods and I think maybe 1 other abortion clinic. So if anybody would like some helpful advice on how to have enough accessibility for women facing unexpected pregnancies, you can look to the Pregnancy Care Center movement and centers like Stanton. Again, nationwide, we outnumber abortion clinics 4-to-1. So if you want accessibility, look to us, look to what we're providing, and also it makes the the charges against our centers and wanting to shut us down. I think Senator Elizabeth Warren said, let's go after clinics like Stanton Healthcare with $100,000 fines to shut down what we're doing. So how can you want more care for women in one breath, abortion care, and explain all these scenarios where women are underserved and marginalized, and then go after the exact clinics that are providing those services very well in our nation?
That's great, Ms. Swindell. You know, my job is to be a voice for Kansans, and one of your jobs today is to be a voice for your patients.
Yes.
What would you like to share that if your patients were here today, what would you share with us that you would think would be important for senators to know?
Well, I would like to share with you, if I may, one of our client stories. She gave it to me, and I said I would do my best to share it. You have it in your written testimonies that I submitted. I just highlighted a few parts to save time, but if I may, this comes from a Stanton client, JC. I was in a very bad place in my life when I decided to get an abortion. My mom told me she wouldn't have anything to do with my baby. My boyfriend was a drug addict and causing abuse in my life and left me, and I was diagnosed with having severe panic attacks. I drove to Planned Parenthood and saw Stanton Healthcare across the parking lot. I went to Stanton Healthcare and found that they are a real clinic that helped me with everything I needed. They loved me and showed me I wasn't alone, gave me things I needed for my baby, counseling to get out of my life-threatening abusive relationship, and encouraged me that I could have a life with this baby. Seeing my daughter's heartbeat made me stop feeling the panic attacks that made me want to abort and stop feeling the horrible nausea and see my baby as a real person that I couldn't kill. It instantly made me feel attached to my baby and love her. I felt led to start my own business, and for the first time in my life, I can provide for my children on my own and have more than enough. They impacted my whole future and my children's future. I am so glad she is in this world now and in my life forever because I was able to choose to keep her with Stanton's help. I thank God Stanton helped me get out of fear and choose life. My mother is in her life and happy I had her. It impacted her as well. My daughter has a sister, and I found a man that loves us all. All my fears were lies, and had I aborted my little girl, I know it would have caused me to carry shame and depression. Thank you, Stanton, for me and my baby. She has a future life because of you. This story to me is important. Number one, it shows the hope that a woman found, quality care and services, but it also shows that abortion isn't the solution. She got out of an abusive relationship. She got out of an economic situation where she was lower income. She was able to start her own company. The depression and the anxiety went away. This became a catalyst for hope in her life because she had the care and the support that she needed. 50 years of unfettered access to abortion has not solved broken systems, and throwing abortion at women does not fix their problems. What she found at Stanton Healthcare is what changed things in her life. Thank you.
Thank you. Madam Chair, may I have a closing remark then?
Very shortly, we have a vote, and I have a closing statement as well, so please.
All right. Well, thank you, Madam Chair, for hosting this committee. Thank you so much, Ms. Swindell, for giving us a message of hope, a message that this world greatly needs today. And like everybody in this room, we're glad that our moms chose life.
Right.
I want to publicly, number one, is condemn all violence, vandalism, threats, and attacks. There's been at least 40 attacks of violence and vandalism against pregnancy centers and churches, like in Kansas, in Overland Park at the Church of Ascension. That's certainly not the answer. Next, I want to point out my concern that last week the White House is hosting Kansas legislators in an attempt to interfere with the Kansas Value Them Both Amendment. The Biden White House has created enough hardships for Kansans, like the price of gasoline and groceries. We don't want them forcing their radical values on the people of Kansas. And I'll close with this. I've spent my entire career, professional career, fighting to protect the life of moms and babies in the delivery room, in the emergency room, and in the halls of Congress. And protecting their lives and well-being will continue to be a priority for me, to ensure that women have access to family planning services, contraception, and birth control, to make sure that every woman has care during, before, and after the pregnancy. But we'll need collaboration, and I'm committed to continue to work across the aisle to provide these services and to improve our maternal mortality rates. Indeed, abortion is not the solution. Thank you, and I yield back.
Thank you. You know, as we conclude this hearing, I'd like to once again thank all of our witnesses for being here. But I want to make clear, we have seen attempts from Republicans to distract people from the truth, to say that they don't want to control women's bodies, even as abortions are being canceled and women are forced to stay pregnant and give birth against their will, to continue saying it won't be that bad, even as people are now losing access to life-saving medications. And of course, Republicans are still trying to push this ridiculous, patently false notion that they aren't oppressing women so much as leaving it to states and local officials and politicians to oppress them. That's dishonest. They know full well many women are not able to travel, they don't have time off, they don't have child care, and they don't have the funds. They know that these cruel bans are already creating overwhelming demand from states like mine that have the protected right to abortion. Washington state healthcare clinics are already preparing to treat patients who are fleeing from states like Idaho to get the health care that they need. And what's more, Republicans are already talking about stopping those patients from traveling to get an abortion and stopping people from helping others to travel to get an abortion. And we all heard former Vice President Pence call for a federal ban, a call that other Republicans are continuing to echo. That's not empowering local decisions when you are overwhelming and overruling states like mine. If you want to be honest about this, about making it local, it should be local. Leave it to the patient and their health care provider. The willful ignorance of how deadly these policies are, even when these courageous witnesses today are doing everything they can to tell their story and make us listen, is not unexpected, but it is very disappointing. You can't spin away, ripping away someone's rights, taking control over their body, denying someone medication, or taking away their plans for their future. You can't spin putting someone's life in jeopardy. That's why we've seen a lot of clumsy attempts to change the subject, and let me be perfectly clear, we are not changing the subject, not as long as I have anything to say about it. Women should have the right to make their own health care decision with their family, their doctor, and their faith. That's what I will continue to fight for. I would like to ask unanimous consent to add 2 statements to the record about the impact of DOD on women's health, so ordered, and for any senators who wish to ask additional questions for the record will be due in 10 business days, July 27th, 5 p.m. With that, the committee is adjourned.